So let's talk for a little bit about therapeutic nursing communications. Now, communications is probably the most important skill that you are going to develop as a nurse. If you can't communicate to patients, if you can't communicate to doctors, if you can't communicate to other nurses, if you can't communicate to patient family members, the rest of the staff at the hospital or the facility where you're working, your job is going to be very, very difficult. It doesn't matter how much you know or how well you understand things or how spectacular your critical thinking is. If you can't communicate with people, you're doomed. Okay, so this lecture is going to focus on communication primarily with patients, okay? And the big thing I want you to take away from this is that the best answers and the best communication that you are going to be able to use with your patients demonstrate to them that you accept their feelings as being valid, as being real, and worthy of action. Okay, so the things that you don't want to say, and I'm just going to give you a couple of these because I don't like to focus on the things not to do, but I really want you to take away kind of the theme of these things not to say. You don't want to tell someone, don't worry, right? Because you're not in their position, okay? If you were in their position, you might feel very differently, and maybe they should be worrying. Maybe they are in a position where they should be concerned, okay? So don't tell people not to worry. You don't want to tell them, don't feel blah, 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 particular way, or you shouldn't feel, or I would feel, anybody would feel, most people would feel. You want this to be about the patient, okay? And it's about what they are feeling. So you need to demonstrate to them that you accept their feelings. Whether they're right or wrong doesn't really matter because there's no good and bad in a patient's feelings. There's no bad feeling and there's no good feeling. Okay, everything, it just is what it is. A spade is a spade. So you accept them for being real and worthy of action. So I'm going to share some techniques that you can use to talk to your patients. And I don't want you to memorize the specific techniques. I just want you to put all of this together and synthesize it and take away kind of the big picture of what it means to communicate therapeutically to a patient so that when you see these answers on an exam and on the NCLEX, that they'll jump out at you as being things that you're familiar with and are part of this theme. I do want you to be careful when you're talking to a patient who is anxious. You want to make sure that you are using a stepwise approach in communication. You don't have to solve the problem all at once. Okay, and in fact, solving the problem shouldn't be your goal. All right, the patient is going to either transition to a point of better health or they are not. And we would like to guide them there, but that is not our goal. It is not our goal to fix anybody or anything. Okay, so when you're talking to anxious patients, you want to be very careful not to exacerbate that anxiety that they're having about their experience at that moment. So the first technique that you can use in therapeutic nursing communication is offering yourself. Okay, this is about nursing presence. It's about letting the patient know that you are giving them your time, and patients know that we're busy as nurses, right? They're aware of that. We don't need to tell them that we're busy. They already know that. And so when we sit down in their room, when you pull a chair in, when you lean over on to the countertop to listen to them and give them your time, they know that you are present and that you desire to help them. So things that you can say to a client that demonstrate you're offering yourself is you could tell them, say, I have some time. Is there anything you'd like to talk about? Or is there anything else I can do for you right now because I have the time? Or you can just say, I'm going to sit here for a while. Is there anything that you'd like to talk about? Those are good ways that you can offer yourself. A second technique you can use is to give recognition. This is really about acknowledging and indicating awareness of your patient and what they're feeling. So statements that you could use would be, I've noticed that you combed your hair or that you made your bed, or tell them that I've noticed you did a great job eating your breakfast. You're giving recognition for something that they've accomplished. This is one of the things that I love to say to a patient is that they're making progress about something, and they get wrapped up in their disease or in their condition or in their hospital stay, and they get anxious about that, and they don't see the little steps that they're making. So even if it's something as simple as they have 2 IVs and they're getting better, and one of the IVs isn't flushing, so we're going to discontinue that IV. So you take out the IV and you say, hey, we're making progress. Or when their diet gets advanced from a clear liquid diet to a full liquid diet, you let them know that's a step, that's an accomplishment. So give them recognition for that. Right? Another technique that you can use is silence. Silence is the art of nonverbal communication. And what you need to understand about silence, though, is that you're still communicating even though you're not using words. Okay? And this is a great tool to help encourage clients to elaborate on a topic, and it shows you're interested in them and that you're accepting of what they're saying. So the first step you need to do is shut your mouth. It's really hard. It's really hard for me. I know that. And the second thing you want to do is to sit down. Sitting down indicates that initial technique that we talked about, offering yourself, but it also demonstrates that you're there for them, and it's telling them that you care. Okay, you're not saying anything by sitting down. You're showing them. And things that you can use in this process, you can smile, you can nod your head, and the biggest thing in nonverbal communication is eye contact. Have you ever had a conversation with somebody where they don't look at you, and you're speaking to them and you're telling them something important and they're looking off into the distance? There's a study recently about physicians listening to their clients and taking notes on the computer at the same time. And they were saying that it's really more important for the physician to sit and look at the patient and listen to what they're saying and be engaged with them while somebody else types in the notes into the computer. So this is very similar. Use silence, but silence is not ignoring your client. It's paying attention to them and using nonverbal cues. Another technique you can use is phrases that demonstrate accepting. And it's giving the client the indication that you have received what they're saying. It doesn't mean you agree with them. It just means that you understand what they're saying. Okay, so this is things like nodding your head, or you'll say yes and encourage them to continue, or mm-hmm, or I follow what you're saying, Miss Jones. And it doesn't mean you're agreeing with them. It just means you understand what they've said. You've heard what they said. Another technique you can use are broad openings. Okay, this gives the patient the opportunity to take the initiative. Right? It gives them the lead. It gives the client an opportunity to take charge of the conversation and talk about what they want to talk about. It doesn't matter what you want to talk about. It matters what they want to talk about. So phrases you can use are, what are you thinking about right now? Or, is there something you'd like to talk about? Or, tell me what's bothering you. Those are great things that you can use as broad openings to get your patient talking, get the client talking, and find out more about what's on their mind. Okay. Another technique you can use are general leads. These encourage the patient to continue their thought, what they were talking about. It shows acceptance and encourages the client to elaborate. So the client will make a statement, and you'll say, okay, go on, or well, what happened next? Those are good things that are general leads that lead the client to continue elaborating. Another technique you can use is encouraging descriptions. So this encourages the patient to verbalize their perceptions of something. It gives them an opportunity to share their perspective with you so that you understand where they're coming from. You can think phrases like, tell me when you feel such and such, or what do you think is happening, or what do you think this means? Those are good things that help encourage the client to describe what it is that they're experiencing. Another technique you can use is to state observations. Okay, this verbalizes your perceptions of what's going on, not right or wrong, and you're not judging them. This is really good for clients who may be nonverbal, or just clients who are just not yet ready to talk. This has happened to me a couple times where I've had patients, you go in the room and They just aren't ready to have a conversation yet. They're not ready to start processing and dealing and verbalizing what it is that they're feeling. So you can start the conversation, and again, this is part of that stepwise approach. So we're just going to make observations. And I just say something like, you don't appear as tense today as you did yesterday, or you look more comfortable today, or you seem like something's bothering you today. And let them respond or not respond. That's their prerogative. If they want to talk, great. If they don't, that's just fine also. We do want to encourage them, but we also don't want to pry. Another technique that you can use is sequencing. So this is relating events to time. So you could say things like, what led up to such and such occurring? Or was this before or after some other event? And this is good because it helps the client clarify their own thoughts, and it also gives them a perspective of cause and effect. So they may see something or some pattern may emerge to them that they didn't otherwise see. Right? And this is something that the client is revealing to themselves. It's not you saying to them, every time you do this, this happens, something else happens. This is them realizing it. Okay, nobody likes to be told what to do or what it is that's going on. They like to come to that conclusion on their own, and that's our job to guide them in that path. Another technique you can use is reflecting, and this basically redirects the conversation back to the patient, and it helps them recognize their own feelings and indicate that their perspective is valuable. So this is a great technique, probably one that if you don't take anything else away from this lecture, take this one technique away. So this is a great technique to use when a client asks you a question, like, do you think I should tell the doctor, or do you think I should call my mom? What your response is, do you think you should call the doctor, or do you think you should tell your mom? And this lets them make the decision and reminds them very subtly that they're the one in control, that the client is the one in control and able to take charge of their care and be, an integral part of that process. Another technique you can use is focusing. And this is good for when a patient starts really rambling and talking about a lot of different topics or a lot of different things. It helps them concentrate on a single point. So you can say things like, is this point worth exploring more? Or this word seems really important to you. Tell me more about this. And that will help clarify and focus on a particular part of the conversation that may be most important, but it's getting lost in all of the other noise that's going on. Another technique is identifying themes. And you want to ask the client to identify themes. So this helps, again, recognize cause and effects, and it may help reveal to your client things that they didn't otherwise see. So you can ask them questions like, so what happens every time you something, right? Every time you call your brother, or what happens every time you, go out to a bar, or some event that you see occurring over and over, some theme you see recurring over and over, and you're just subtly drawing it to their attention, or you are helping them identify the theme. Another technique you can use is exploring, and this is going in a deeper dive. So it keeps things from being superficial, and you don't want to force taking a deeper dive on something that might make the client uncomfortable. But these are phrases like, so tell me more about such and such. This is kind of like focusing. Focusing, the difference between focusing and exploring is focusing draws the client's attention back to a particular part of the subject, and exploring goes deeper into that subject. So you might ask another good exploring question, be like, so what kind of factory did you work in? Or, what kind of accident was it? These are things that help explore that concept. Another technique you can use, and you have to use this one carefully, is to present reality. Okay. Now, we're not correcting a patient when we're presenting reality. We are simply calling a spade a spade. This is just, all we're doing with this is indicating that there's another option for the client to consider. Okay. They might consider it and they might not, but there's no right or wrong. Okay, so things like a client says to you, my mom's such and such, and then, but it's our job to say, if their mother's not there, that, well, Miss Jones, no one else is here with us right now. Okay, you're not telling them that they're wrong, you're just presenting reality. Okay. Another technique is to seek clarification. And this is used to make clear what's important or what's valuable. And it shows them that you want to understand. So techniques that you can use for this, phrases you can use are saying, I'm not sure what you mean by such and such. Or, what would you say is the main point from all of the stuff that you just said? And it's drawing the conversation back to the client and letting them clarify what's most important. Another technique that you can use is giving information. And this is just used to give clients the facts that they need so that they understand what to expect about something. So this is just something as simple as saying, my name is Jake, and I'm going to be your nurse until about 7:30 tonight. Now they know what to expect from our relationship. Another way of giving information might be something like, hey, Miss Jones, I'm just coming in to check your vital signs again. Or, the tech is going to be in a few minutes to check your blood sugar. If it's over 141, I'm going to be back in and I'll probably have a unit or two of insulin for you. Just giving them some information so that they know what to expect. And you need to use your judgment on this. Some stuff they need to know and other stuff they don't need to know. And especially if you have an anxious client or a fearful client, you want to use good judgment on what to include and what not to include. Another technique you can use is to encourage self-evaluation. So this is providing some perspective and relationships to the patient's values. Okay, so this is kind of like motivational interviewing. These phrases that you can use are, does this make you feel more whatever? Or how important is such and such to you? So here's a good example from motivational interviewing where you might ask a client who, say they're an alcoholic client or they're a smoker, and you say, well, how important is it for you to stop smoking? And they say, well, it's about a 3. And you'll say, okay, that gives us a good starting point, but, how come it's not just a 2? Well, they say, well, I have a granddaughter now and it's really important for me to see her. And so, it is a little bit more important to me. And it's just helping them reveal to themselves what's important to them. Another technique you can use is collaborating. And this is working together with the client to solve a challenge. And it shows them that we support them and that we're going to help them feel like they're in control. And they need to take responsibility for their health. Okay, we're not there to fix them. We will help them through their process and we will support them, but it's really their job. If they're not going to manage their blood sugar when they go home, then, we can only do so much at the hospital. We can't fix them and cure them while they're there. So what we'll do is say something like, well, let's see if we can work this out. Or perhaps we can try to discover a way to whatever. Okay, these are helping help the client feel like we're ready to collaborate with them, but it's their responsibility. They need to take ownership of it. Another technique you can use is summarization, and this is helping organize thoughts and ideas. Okay, and these are phrases like, so far what we've discussed are, or a phrase like, so do I have this correct? And then restate what they've talked about. And this identifies some important points, and it puts both you and the client on the same page and gives them an opportunity to clarify anything where you may be off. And another great technique you can use is to encourage plan formulation. Let's make a plan. This is giving some perspective into the future, and it helps provide hope and actionable items, and then some future confidence if they end up in a similar situation. So these are things we want the client to come up with a plan themselves. We don't want to tell them what to do. So we can ask them a question like, so what can you do to prevent this in the future? Or what can we do to help you, keep your finger stick blood sugar in a good range, or to keep your blood pressure down? These are phrases where you're helping encourage them to think about the future so that when they get in that situation, they have actionable things to do. And then the last technique I'm going to share with you is about restating. So restating gives the patient the opportunity to build on the thoughts from a new perspective. So this is a clarifying talk, and it gets the patient to hear their own words. Sometimes it has a little bit different impact when their words come from somebody else and they hear it from somebody else's voice. They may realize, wow, that really doesn't make as much sense as I thought it did, or wow, it really isn't as big of a deal as I thought it was, or as I feel it is when I hear it coming from somebody else. Just gives them a different perspective. So these are phrases like the patient says something like, oh man, I've been up all night. And so your response is, so you're having trouble sleeping? So basically what you've done is just restate the obvious, and it gives them an opportunity then to continue the conversation. You might say like, well, I wasn't up all night, really. I guess I wasn't having trouble sleeping. I just fell asleep really late, and that's why I've slept in a little more. It just gives them an opportunity to clarify. So in summary of these therapeutic communication techniques, I don't want you to memorize each technique, but go through these phrases and examples and draw out from it the big picture. Okay, we want the client to take ownership of what they're experiencing. We want them to guide the conversation. There's no good and there's no bad. And there's simply the facts, and the patient or the client can accept them and transition to a state of greater health or to a less healthy state. And that's their choice. That's what they're allowed to do because they're in control of themselves. One of the things that people get stuck on a lot of times on psych-related questions and communication-related questions are empathy questions. Okay, so when you're taking an exam and you're answering empathy questions, first you have to know when are they asking an empathy question. So empathy questions have a quote in the question, and each answer has a quote in it. Okay, so this may come to mind now that you've taken some practice exams and stuff, and you think back, well, yeah, that question had quotes in it, and then each of the answers had a quote in it. So these are empathy questions. And what you need to do is put yourself in the client's shoes and say the words in the question as if you really mean them. Okay, and then do the same thing with each of the answers. Put yourself in that client's shoes and say it as if you really meant it. Like, is this what you would really be feeling? And so ask yourself, if I said those words and really meant them, how would I be feeling right now? What would I be feeling right now? Okay. And then you want to choose the answer that most reflects what that person would actually be feeling at that moment. You don't want to respond and select an answer that you would think is what they would be saying. It's not what they would be saying. Don't think of what they should be saying. Think about what they would be feeling. Okay? So, empathy questions have a quote in the question, and each of the answers are also a quote. You want to put yourself in the client's shoes and ask yourself, if I was this person, what would I be feeling? And then select that answer. Not what you're saying or what you would be saying, but what you would be feeling if you were in their shoes. So, quick summary, the things that you should look for in good answers are reflection questions and responses. They're open-ended questions. They're always better than close-ended questions. Shorter answer questions are better. Things that are not as good, you don't really want to ask why questions. And anytime an answer has the words I, me, we, or us in the subject, usually aren't good answers. It's not about me. Okay, this is always about you, the client. You want to avoid guarantees in psych. We don't know what the other person's experiencing. We don't know what they're going to experience. We can't guarantee anything. The only time it's okay to guarantee anything in nursing is if it's in med-surg and it's something that's going to be 100% true 100% of the time. Okay, so you want to avoid saying phrases like, we can perform such and such, or you'll improve if you, or if you do such and such, then something will occur. Those are things that you want to avoid. You want to avoid making guarantees, especially in psych. Usually the best answers with therapeutic communication and in psych help the client understand that you as the nurse are going to help them deal with what they're experiencing right now. So you don't want to change the subject. You don't want to choose an answer that says something like, refer the patient to a specialist, or ask the client, have you spoken to such and such about this? Or why don't you talk to someone else about this? Okay, you're there, you're with them. What are you going to do for them right now as their nurse? Okay, remember, we're not there to make medical decisions, or we're not there to be their psychiatrist, and you're not a psych liaison nurse, okay? You're a new graduate nurse taking the NCLEX, and so what are you going to tell this client? You're not going to tell them someone else will fix your problem. You're going to tell them what you can do for them right now, you, not somebody else. And you want to be as concrete as possible in what you're saying to them. So you want to look for answers that say exactly what they mean in a literal sense, word for word. So you want to avoid words that use slang or figures of speech or sayings, proverbs, allegories. You want to use, simple, direct things that mean exactly what they say. So I hope this gives you a little bit better perspective of how to approach some psych questions and some techniques and a mindset or a mentality, if you will, about therapeutic nursing communications, and, really remembering that there is no good or there is no bad, and it's just our job to help reveal to our clients what it is that they already know, but it may not be so clear to them. So remember, you don't have to solve their problem. You don't have to do it all at once. Take a stepwise approach and make sure that you are keeping the client in control of their care. And the last thing I want to touch on real quick are phrases to avoid. These are always wrong, so you want to rule these out. I'm throwing in a couple of the golden nuggets here at the very end. Okay, you don't want to give advice to patients. They don't need to be told what to do. You don't need to do that. That's not your job. Your job is to help the patient formulate their own solutions and alternatives. Okay, so you always want to avoid these phrases. Suggest that they do such and such, or don't do whatever, or recommend that they, or you should, or tell the patient to, or advise the patient to. These are all phrases that you want to avoid. The best phrase is always, what do you think you should do, Mrs. Jones? That's always the best phrase. Put it back on the client, and again, help the client keep ownership of their condition and help them remain in control and the decision maker. And that's the essentials of therapeutic nursing communication.